Hey everyone, this is Dr. Connie for Mind Your Health podcast. If you haven't done so, please subscribe. I'd love to hear from you. But I have a feeling after this topic that I'm going to be talking about, the disjointed healthcare system, you're going to have a lot of questions and comments and share in all the experiences that you all have. Because today I want to delve into a critical issue relating to all of us and our health. And it really is about the healthcare system crisis and explore why it may not be serving us as well as it could, okay? I've been a clinician for as long as I can remember, 27 years to be exact. Yes, and I have to say that specialization is really become or has really become the state of healthcare where we're taught as clinicians to compartmentalize the human body. But I just want to say it just doesn't work, okay? Your body works as a whole being. We need to fix you as a whole, at a whole level, not just break you down in pieces and fragment you all over. Because within every field, we break the body down further into parts and are often taught to say, it's out of the scope to practice, and we refer out. And those of you who don't know me, I'm a doctor of physical therapy working in this rehab field for over 27 years. Tons of continuing education. I specialize in pelvic floor. I've specialized in craniosacral therapy, visceral mobilization, as well as dry needling is my go-to because it works. But with specialization, even within my field of physical therapy, we can specialize just in pelvic floor, or we can specialize in shoulder rehab. We can specialize in urology. We can specialize in the spine, the joints, knee, low back. All the things are available to us. And the more specialized you become, the more expert of that. But I've learned over working with various, like thousands of bodies over the career of my life, over the course of my career in my life, I have to say that your body part just does not work by itself. Everything needs to be integrated, okay? And this breaking down system does not work, this compartmentalization, because it really puts us in a bind with continuity of care. And as I told you, we have, as a physical therapist, I have ICD-10 codes, which must be aligned with the CPT codes for billing. And when a patient comes in for a shoulder, did you know that I can only treat that shoulder? But if you come in for a left shoulder injury, almost always you're going to have to check out the neck, as well as the opposite hip and down the kinetic chain is what we call it, because our body, shoulder works in conjunction with your spine. And the scapula that's attached to the shoulder works in conjunction with your rib cage. And your rib cage is intimate with your thoracic spine. So it involves everything there, okay? And that CPT code and as well as the ICD-9 code or 10 code now, this is all dictated by the executives of the third-party payers like Blue Shield, Blue Cross Blue Shield, as well as United Health and all the other health insurance plans that we have offered to us, right? These executives, though, don't have any clinical background determining what docs and practitioners like me can and cannot bill or do. Because our hands are tied if we're a clinician in the system, we have to do what they say, not what's best for you using our expertise, but we have to do what they say. And that's where you as a patient falls through the cracks. We never get to the root issue. Also, specializations tend to break the body parts, right? We have an ENT for ear, nose, and throat. We have an endocrinologist for diabetes management or anything hormone related. We have an orthopedic surgeon that works on the bones and the joints. And then we have a cardiologist, OB-GYN for your female parts, and rheumatologist for autoimmune and all things arthritic, right? So this is just to name a few, but these specialists are really trained to specialize in that small area. And often they don't talk to other healthcare, and it's not cohesive, or healthcare system and other practitioners. It's really not cohesive. It's broken. It's fragmented, disjointed, as I say. And in my experience, when tagged with a condition like autoimmunity, lupus, or a disease, especially in the autoimmune world like mine, mystery is the norm. And when the doctors just doesn't know what to say because of this mysterious symptom that involves my gut, my hormones, everything, shrug their hands or shrug their shoulders and tell me, it's your lupus. And I have to up the medications is about all I am told. And you know what? Most of the doctors, I have doctors in the family, I have close friends who are doctors, they're beginning to recognize how fragmented the healthcare system is. And remember, primary care or internal medical doctors, their primary role is to diagnose and treat the minor issues and are mainly used to refer patients out to the specialists. They are the gatekeepers for your insurance policy, right? Yes, they do treat the infections, give you antibiotics when you need, you get the physical, but when you're faced with real symptoms, I know many of you have experienced this. They can't figure it out because the labs are normal, right? And to add to this, in our fragmented healthcare system, we often treat symptoms without looking at the bigger picture, which can prevent us from achieving the true holistic healing. Because the truth is, when your body is integrated holistically, it functions at its best. And when its harmony and balance is established on the inside, your body produces the perfect biochemistry or biochemical endogenous hormones and chemicals that it releases all from within through your organs, endocrine system, the nervous system, everything adds to it, digestive system. It has a dynamic effect. It involves every single organ of your body, okay? And I just want to go over some of the reality facing the healthcare system, how it came to be. Because I personally had to navigate the system, and it's really hard. Not only is it expensive, but now the doctors, hospitals, they're not billing correctly. And I've had to fight, and I was billed over $200,000, you guys, for all the services that were rendered simply because they were out of network, or the practitioner at the hospital that's in network were out of network. So I just want you guys to know, if you have a hefty medical bill, you can utilize the No Surprise Act. Look this up. No Surprise Act is when the practitioners who are out of network cannot charge you without letting you know. Bills started to flood in because of this big glitch for me. I had to argue it out, not to mention the mental stress of owing that much money and they're saying pay up. It was a hot mess. I was able to get it resolved, but you have to put your foot down and know how to navigate the system, because they can really rob you blind, okay? And if you or your loved one is currently experiencing or have experienced a similar, I would love to hear from you. Please reach out and DM us, okay? So the current state of healthcare. Do you know where the origin of specialization came in? Well, the compartmentalized approach in healthcare, it really emerged out of the need for specialization in medicine with growing medical knowledge in the late 19th and the 20th centuries. Okay? And this advancement in medical technology and knowledge have encouraged further specialization, leading to a variety of medical fields that often operates independently of each other, which is a problem. And the state of today's healthcare system has its various independent specializations all over. Even within the small field of physical therapy, we have different specialists, okay? For example, a patient may have separate doctors for their gut, their hormones, their mental health, their diabetes management, cardiac issues, you name it, rheumatology issues, they're all different. And this is really hard on a patient who have multiple issues and symptoms that they're living with, especially those who haven't been diagnosed even, right? And these practitioners may not communicate effectively. They communicate through you telling them about who you're seeing. And then there are misdiagnoses, because without a holistic view, doctors may miss signs and other conditions that fall outside of their specialty. For example, physical symptoms can sometimes stem from mental health issues, and these may be overlooked in a compartmentalized system. There's a serious gap in our system, is why so many patients are left feeling sick without any answers. Also, the disjointed care can lead to lower quality of overall care, okay? As there is nobody overseeing all aspects of patients' health. There's no accountability for anybody. You can't point the finger at anybody. And we cannot dismiss the mental health implications of this confusion, because mental health is often neglected in a compartmentalized system. It's missed completely. And many physical health conditions have mental health components that need to be addressed. But in a disjointed system, these are often overlooked. So in social media, there's a lot of advertisement about mental health. A lot of celebrities are bringing the importance of this back into our attention. And the burden, you guys, is placed on the patient to coordinate their own care across multiple providers. And this can be particularly challenging for patients with numerous medical issues like me, which can lead to mental health issues. It was so confusing. It was so hard for me to go to acupuncturist, the Chinese, traditional Chinese medical doctor. This is not just conventional medicine. This applies to the holistic medicine. I was fully trained through the Institute of Functional Medicine, but we still miss so much between the lines. And that's why I've completely revamped my practice to include these aspects to bring wholeness to this approach. The mental stress from dealing with the disjointed system itself can negatively affect health outcomes. And that's what I had to really experience as somebody who's lived with an autoimmune condition for as long as I can remember, like as long as I've been a doctor, a physical therapist, right? Graduating from a prestigious school, education, all the stuff, I was told certain things. And then I got pregnant, had a family, and then I started to get lots more issues into my life. Little did I know that the toxic marriage and relationships at the time was what was feeding my illness. And I've had my kidney involvement, digestive issues, skin issues, hair issues, hormone issues, and I had to pave my way and navigate the whole system. And it's the same way in the holistic space. It's no different, because you have to go across town, go to chiropractor, go get a massage, go get some craniosacral therapy, go see a functional medical doctor who tells you all the tests are this, take these supplements, come back in 3 months. And often all the specialized testing were cost prohibitive. And it didn't really mount to anything. And I realized unless I changed, my symptoms are here to stay. So a lot of my doctors tend to blame it all on lupus. Whenever I was hospitalized, near-death experiences, and all the things that I have to go through, it was really a painful path for me, but I really learned a lot about what the medical doctor's roles are. In the hospital, you do get some integrative kind of people do communicate interdisciplinary with the pharmacist and really your attending physician and all the specialists that come and poke you around. And they chart it. That's the extent of it. They don't really look at you in the eye, see you as a person. They see you as lupus, right? And then they're mixing all their expertise up in their compartmentalized expertise, bring it all together. And before I know it, I had a laundry list of medications when I was in the hospital. And a lot of the times it wasn't the real issue. So they had to do a lot of tests. Nothing came to surface. But I will tell you, that was one isolated incident where I was hospitalized, near-death experience. And I know that that was a mental and emotional challenge that I had to go through in my life. A story for another day. But that really devastated me so much. I felt my physical body just completely go downhill at that time. So bringing the focus back to you, what does this even mean for you, right? What are the implications of the fragmented care? Well, let me put this in context. Fragmented care is a situation where a patient, you, receives medical services from multiple healthcare providers, often specialists that are very experts in a specific part of your body, who do not effectively communicate or coordinate with other specialists for different parts of your body. And this fragmentation can lead to uncoordinated and potentially inefficient or ineffective care. I'm not saying it's always the case, but it can, and often it happens. And poor management of chronic conditions in this disjointed healthcare system, there's an inadequate level of coordination among different specialists treating a patient with multiple chronic conditions, much like me. And this could lead to each specialist focus solely on the disease within their own expertise, leaving you at the mercy of that and ignoring the interplay between the different conditions. And as a result, one condition could potentially worsen while another is being treated. There's an imbalance that might be created within, leading to poor overall management and outcome. And your health might be declining because of it. Next one is over-medication. I cannot tell you how doctors are so quick to prescribe you something. That's their answer to everything. And that's what they're taught in school. And since various specialists may not communicate effectively with each other, they might not have a complete understanding of all the medications patient is currently taking. I saw this a lot clinically. And this can lead to over-medications and medication side effects and overlap and contraindicated medications, and the patient is left with those symptoms, right? And when medications interact harmful ways, it can really poison your body, okay? And decreasing your quality of life. And remember, once the damage is done, it's really hard to spring back because you're already at a compromised state, okay? And then there's the contradictory treatments. Without a central coordinating point or effective communication, a patient might receive conflicting advice or treatments from different providers. For example, one specialist might recommend a certain type of exercise to improve the condition, while another might advise against it due to a different health issue. I ran into this a lot with my patients. This is not only confusing to the patient, but also can cause harm if opposing treatments interfere with each other, leaving you yet again to make that decision, and the burden is on you. So this lack of coordination in healthcare can lead to a multitude of physical health implications, including poor disease management, symptom management, over-medication, and contradictory treatments. So it's critical to address these issues in order to improve your outcome and enhance the overall efficiency of healthcare system. And unfortunately, unless you're you have knowledge about these things, it's hard to navigate on your own. So here's what brings me to do this podcast. I believe there is a need for a more integrated approach, empowering you as a patient, right? So what are the benefits of integrated healthcare? Well, first and foremost, it needs to be patient-centered. Integrated care puts the patient at the center of healthcare experience, ensuring that your needs and preferences guide all aspects of your healthcare. Second is all about holistic view. This integrated health care provides a comprehensive, holistic view of patients' health. You're put together as a whole being, viewed as a whole being. We're looking at the interaction between different systems of your body. And this approach allows for a management of patient health in its entirety, rather than focusing on an individual disease or condition, because that can perpetuate the imbalances within. Third is better communication. With a better flow of information between the providers, it's less likely that important details will be overlooked. And this can lead to a more accurate diagnosis and more effective treatment plans. Lastly, preventative care. And I've been always told prevention does not sell. Well, I'm here to sell that. Prevention is key to your optimal health. Without health, you have nothing. I've experienced it. Without health, nothing matters. An integrative system is more conducive to preventative care because it's better equipped to monitor patients' overall health and intervene before the minor issues become major problems. Here's something that happens. Something so local, like in your shoulder. You have an impingement in the shoulder. It can now become segmental, affecting your whole arm. It can affect your neck, right? And then it can be systemic, meaning it starts to alert your immune system. It starts to alert your digestive system, stress, adrenal glands, affected by the sexual hormones, affecting your solar plexus, celiac plexus, right in your gut. And then thymus gland, right at your heart. Thyroid, pituitary gland that manages everything in your body. And then lastly, pineal gland up at the top, which is controlling your sleep-wake cycle. So how many of you guys struggle with sleep? And did you know if you take melatonin, you're telling your pineal gland, back off, I got some exogenous sources, so your organs might not work as effectively. So too much supplementation without really focused goal can set you off on the wrong path of imbalances, okay? The integrated approach allows for simultaneous care for the body, mind, and your soul or spirit, which contributes to your holistic healing. There are psychological benefits of an integrated approach, including reduced anxiety due to better communication. You're at ease, your security and safety is not threatened, and you have more of an involvement in your own care, okay? And I want you to know that your socioeconomic status and living conditions also do matter, and your ability to take care of yourself, like self-care, super important. And current healthcare is all about doing it a certain way. Why? Because that's how it's always been done. I was stuck in this pattern for as long as I can remember. And I just want you to know there's going to be a lot of resistance from conventional medical practices and doctors and practitioners, and the challenges are real for integrating diverse disciplines. I've always faced the challenge as a physical therapist wanting to give nutritional advice. I had to put different hats on doing what I do. And it was really hard because physical therapy involves healthy nutrition. I couldn't talk about it. It was outside of my scope of practice. And when I was a registered dietitian, I couldn't help my patient move better, even if she told me she had shoulder surgery and I had to refer them out to a physical therapist. Disjointed again. There's no continuity of care, right? And then when you go to yoga class, you hope for the best with your low back and such. But we just want to make sure that everything is in alignment, right? And everything comes together. And the inherent resistance to change is not your doctor's fault. It's an established system. It's a belief system. And many healthcare practitioners may feel that their current methods are effective, and they truly believe they're helping their patients because that's how it's always been done. But more and more of you who's educated, who's thinking outside the box because you're just not feeling good, are asking questions and they're demanding a better system. Okay? So these challenges, bringing together healthcare practitioners from diverse disciplines, they all have different language that they talk, treatment philosophies, as well as methodologies. And this is a real one. There is a professional turf battle. There might be resistance due to perceived threat to professional roles and responsibilities. For example, specialists may feel threatened if they believe that an integrative care team could dilute their role or undermine their authority. It becomes an ego thing for them. So even for me, I'm a dry needling expert. I have to be very careful about saying anything. I can't say anything near acupuncture or meridians, for example, even though it's acupuncture needle. Context is completely different. I'm a registered dietitian, highest form of education and different, clinicals that we had to complete versus a nutritionist who might have gotten a certification online for 6 months or even 3 months and call themselves nutritional experts, right? There's terminology that's really confusing. There's chiropractors and also physical therapy, turf battle. I can't do I have to be very careful. We do similar things though. And then there's the regulatory and insurance issues, regulatory barriers. There's existing laws and regulations that hinder implementation of integrated healthcare. So you need to know these barriers so that you can do better for yourself. So insurance payers are very involved in what your doctor can and cannot do. And there's the financial challenges, right? So how do you and the practitioners get paid when you go outside the normal ways? There's a lot more people paying up cash-based practices. I practice this way because that just doesn't work. It doesn't get the patients well. I was wasting my time with the insurance payers. It is so much better this way. And I can get results so much faster in a short amount of time. Don't mess around. I just want you and my patients to be well in the shortest amount of time as possible. Not only that, I want their health to be in their control, right? So how do we move towards an integrated system? Well, there are potential solutions and strategies for moving towards an integrated system. And I want to share that. And one of them is interpersonal or interprofessional education. We need to promote interprofessional education that trains healthcare practitioners in a collaborative approach to care from the onset of their education. This needs to start in school. And this would involve interdisciplinary courses and experiences in medical schools and other healthcare training programs. And then we need to learn better manage communication and information sharing. We need an advocate or advocating for improved communication and information sharing among healthcare practitioners who could be facilitated by interoperable electronic health records. Many exist, but still it lacks the continuity of care, okay? And then there needs to be a change in incentives and healthcare reimbursement. And we need a shift from fee-for-service models to value-based care models that incentivize holistic patient outcomes rather than the provision of individual services stuck to compartmentalizing our body, okay? And remember, there are different stakeholders in all of this. This is a big business mess. It's all about profitability. Between healthcare practitioners, patients, governments, and insurers, it's very complicated, right? And everybody, healthcare practitioners should embrace team-based approach. Be open for more holistic approach. Be open for more ideas and really look at the patient as a whole, okay? And there needs to be an emphasis on lifestyle interventions where patients can heal day in and day out every single day. Because a large part of what we do in the stress that leads to all disease starts with our lifestyle. habits, right? And this is where I want to kind of explain to you why I created functional yoga medicine as an integrated approach. I have the luxury of dealing with thousands of patients in all different walks of life and training many yoga teachers, as well as being an intern coordinator, clinical coordinator for different physical therapy students, as well as registered dietitian. I've mentored many students over the course of my career. And I just want to say, I went full board. It took me over a decade to be certified through the Institute of Functional Medicine. In my opinion, it's the highest level education out there. And I just want to say that functional yoga medicine allows me to combine all my background, but combine it with the principles of yoga, East and West, with those functional medicine, addressing the root cause of disease and viewing the body as one integrated system, putting you at the center. What are the benefits of functional yoga medicine? Well, it bridges the gap between different medical specialists to promote holistic health, offering you more knowledge and both physical benefits, mental, emotional, and spiritual, as well as physical like flexibility, mental health benefits like reduced stress. So what does functional yoga medicine look in practice? Well, a person with chronic pain, for example, might use yoga exercises to improve physical function, while also working with a functional medical practitioner to address the underlying cause, such as inflammation, getting treated for different modalities like dry needling to get and nip the symptoms in the bud, right? And different private sessions to address specific parts of their body, all while integrating the movement as a whole piece and making you whole again, right? And I just want to say that this is the future of healthcare. And a lot of our clients, including you who are listening to this podcast, are very aware of the challenges and they're so frustrated. There's not many programs that pull everything in the way we do at Functional Yoga Medicine. This is the future of your health and your control and taking full responsibility over your body. Because I believe your body has the inherent wisdom to heal. All we have to do is harmonize ourselves and really get rooted in who we are and really work with our body, because we never came up or came into this world with a manual. It's time to really learn what it means to connect our bodies, regulate our nervous system, as well as heal our gut, decrease overall body inflammation by making every individual whole again. I would love to hear from you. And as a bonus, we have a Master Functional Yoga Medicine workshop for those of you who are intrigued by this and who wants to learn more about functional yoga medicine. So click the link below. I will see you guys all there. Would love to hear from you through the DMs. Follow me for more. Subscribe to my podcast is number one. And then follow me at Instagram, YouTube, as well as TikTok at Dr. Connie Chung. I will see you guys all next week. Bye.